All right, great. So I just want to welcome the audience to our after show where we have a chance to have a little more discussion with our panelists, ask some of the questions that we didn't get to in the grand rounds period itself, and really give everybody a chance to make sure they really got to get their message out there and state the true import of what we're talking about today, which is the racial disparities, how they're playing out in the COVID-19 pandemic. And so some of the questions that are left, and I'll just direct these to somebody to get the conversation started, but then please feel free for anyone to jump in on this. You know, Lily, I think one of the questions after Samantha is do you anticipate there'll be more funding moving forward to address some of these social determinants of health in light of what we're seeing that's happened with COVID today?
It's a great question, Jeff, because as we think about how we're going to address the various social challenges, we'll need to have funding to address those. And I am not sure.
I'm more optimistic. I think that there will be, if we can continue exposing why the disparities exist. If we can, and then we can link them to things, because there's a risk, right, that the pandemic will go away. Hopefully it'll go away. The pandemic will go away and we'll be left with inequities of other illnesses, education, poverty, heart disease, you know, all of those things. We could be talking about heart disease and the social determinants of health, but it wouldn't be as exciting because it wouldn't be part of a COVID series or part of a heart disease series. And it's easy for us to get distracted back into the like, well, what's the receptor that, you know, responds best to this new therapy, whether people have access to it or not, when we're thinking about other chronic diseases. But if we could use this energy to focus on infrastructure for other chronic illnesses and other disparities in health outcomes, then we could kind of use this crisis to really change the way we deliver healthcare. One example, I think, and our residents have been participating in this too, is the change to telemedicine. Sometimes we think, oh, well, telehealth is difficult for people who don't have access. Maybe that furthers a gap. But if you think about some of the patients we were talking about who work all day at Denver International Airport, can't make it to the Anschutz Medical Campus or to their primary care doctor, but they could take a 15-minute break to have a visit in resident clinic to check their blood pressure or get up to date on their resources. If we can not forget those populations in their chronic diseases as we come out of the pandemic, and link to the policies that Katie was talking about, then I think we could leverage it for more funding is what I guess I should say.
So interesting timing today. Our talk was coincided with a hearing in the House Ways and Means Committee on this very topic, racial disparities in COVID outcomes. And so Ibram Kendi, who I've got my handy book here, he testified in that hearing. And actually on that topic of, so that was, you know, interesting talking about, you know, so folks talking to the federal government about what are their requests and right, what can they do. So telehealth is actually one of the things that was coming up, and I think again this is a really great example of a policy change with a ton of potential, but also there were some panelists on that talk talking for the great need for language services and for telehealth in you know, in different languages, and you know, one of the, you know, the panelists who was bringing this up, talking about how even when she has an interpreter, it's still quite difficult. So what we really need, right, is providers who represent the populations that they're serving and are able to converse fluently. So that's kind of aspirational. But again, I think the optimistic side of that is it's harder to, yeah, I think this is putting a lot of these long-standing needs and disparities in people's face in a different way. I think paid sick leave was another thing that I think just seeing how quickly that, like, people got it finally, right? That like, oh, it actually doesn't work for people to go to work sick, and for them, and you know, to feel like they have to go to work sick because it's the only way that they can make money, and they're going to lose their jobs if they don't, right? And so how quickly that moved on the national scale as this was getting started, I think, you know, again, is maybe a more hopeful point for highlighting, we've always needed that, right? It's always been a bad idea to have structures in place that that don't allow people to take care of themselves, because when people don't take care of themselves, they're also not taking care of the people around them, right? So yeah, I think I have some hope. I think, but again, I don't think it's going to happen automatically. I think we need to continue this focus and push, and recruit more people to pay attention to these things, not just when it's a moment of crisis.
But I think one thing I would add is that separate from identifying additional funds or other resources, I think also allocating some of those funds, because I feel like the structures, we talked a lot about structural racism and the distribution of power, and I keep going back to that New York City boroughs example, because it's so interesting how wealth is so protective. When this came down and word got around that we would all have to shelter in place, people in Manhattan went to their weekend homes, while people in the Bronx were in these very condensed living environments. And they noted that no one was cleaning the buildings at all. Like, there was no sanitation of those buildings. And so I think that, again, thinking about the structures of power and the allocation of resources in those areas that have resources to areas that don't have resources. So I think it's not just asking for money, but let's change the structure.
Maybe a harder question is, how do we maintain that effort, right? I think one thing we've learned is there's a lot of excitement around a novel disease. People want to help, but how long do people send lunches to hospitals? How long do they howl at 8 p.m.? How long do they keep this population in their sights as someone who needs help?
Jeff, I would like to maybe take it. It's, I think trying to go a little bit even deeper into the overall perspective, I think everything that we discussed today talks about these, so like the moral history of the present, or the last few decades. And I think that that here, obviously as Katie, the political part is important, like reaching out to politicians and convince them that this is important. And two, I think that the litigation, like some of these human rights groups are doing, it's really the only way. And Shanta can tell you, I'm not very fond of lawyers, but I came to understand that the civil rights attorneys like ACLU, the Southern Poverty Law Center, they do really good work, and it's very grassroots work. And what I mean with this is that it's not the litigation per se, but it's looking at these very entrenched, slavery type of, historical policies that continue up until today in different ways and different manifestations. And I think, unless it's a grassroots effort, it will be difficult to change. And the comment I wanted to finalize this is that, Shanta asked, and I mentioned this briefly, I found really rewarding, and it's not about, again, I say this because I don't want to sound, it's not about me, but it's about the students. Like, making the students in a class, for example, bringing those concepts, or the residents or the fellows, like the social determinants of health, the political economy of health, the moral economy of life, whatever these large concepts that we're talking about, how do you bring them into like clinical encounters? It's very important because there's tools, that we can use. And the class that we coordinated in January was wonderful, because we only had a few students, but we addressed the biological, but we also addressed the biographical. And there was basically questions on the structural vulnerabilities. So it was like somebody, maybe, the classic, or not a classic, but the unfortunate young woman who uses heroin and has 3 kids that lost to foster care. And then it's basically providing that patient with the antibiotics, the medical care that is needed. But also think about the addiction, the psychiatric component, maybe depression, but then actually move it further. What about housing insecurity? What about food insecurity? What about their legal status? What about their discriminatory aspects? And what I learned is basically the students were, whatever they're going, like surgery, anesthesia, it really opened their minds to that. And I think my point being is grassroots in every way. that includes also educational for our own trainees.
We can also use some positive carrots instead of sticks. So I felt like our talk was a big stick about where bad things are happening. But I think we can think about policies that align with incentives that reward businesses for keeping their employees safe and healthy, for having good policies, for retaining people, for having better outcomes in terms of the health of their employees. And I think probably from a healthcare perspective too, we in the leadership in the school and in the departments can advocate for changes in terms of our incentive systems that reward us for the number of patients that we see, and not necessarily all the time for the health outcomes of the patients that we care for, and certainly not at all for the outcomes of the communities that we serve. And so if we in medicine kind of put some incentives in place that reward us for caring for our community, then we may be able to sustain kind of the level of excitement around these sorts of efforts.
Carlos,
So yeah, I guess, you know, yeah, just you know, as a social scientist, I think, you know, a lot of this too is about, you know, Shanta, you mentioned like get a group together, you know, have 25 folks show up for one hearing, right? If you don't, I think if we all feel like we have to carry this burden on our own and you know, change everything overnight, it's going to feel really daunting. But if you do it as a part of a team, right? If you get involved in, I mean, I think that's what keeps giving me hope in the face of really overwhelming problems, is just being inspired by other people who are working on these things. So like this panel is a great example of that, right? Like this is so helpful to say, I'm not the only one who sees this problem. I'm not the only one who cares about it. I'm not the only one who's working on it. And I don't have to solve it on my own, but I can be a part of a team and we can coordinate and say, okay, so this is my, you know, my focus is on doing the research that's going to, you know, move the needle on what we know about these disparities, or I'm the one who's going to be showing up at the Capitol every week because that gets me going, right? So figuring out what your role can be and how you can do something that, you know, works for you, works for your life, works for your schedule, but allows you to be part of something bigger, can keep us going.
That's great, thank you. Carlos, question for you from the audience has to do with, you know, balancing, I think what people understand is that prisoners living in close conditions are likely to spread disease to one another versus the fear of emptying out a prison population. You know, I think there's a lot of people who fear having, you know, people who've been in prison or even just jail, because I don't think a lot of people know the difference between the two, back on the street. How do you work with the community at large to get them to understand who those people are in those populations?
Sure. You know, so last week I was part of this webinar with the it's called the Sentencing Project, and it was a great experience, Jeff, because there were like these, you know, and again, you know, these big professors in law that have been studying these, and it was great to see, because some of the publications or the books I read, you know, basically these professors. And what is interesting to understand, and I read some over the weekend and tried to read as much as I can to catch up and be able to understand also that angle as much as I can, is that the evidence is very interesting, because the number of people, like if you look, for example, at jails, so like if you're a judge and you decide, and again, these are publications in Science and Nature and PNAS and really high level journals, where these sociologists or these criminologists do research and show that those people, like the 90% that I spoke about in jails, who had no money to pay for a bail, which sometimes is as low as $100, they don't have to pay the money. They stay in jail for a year almost until their sentencing, and then they're released. And in that process, again, as I mentioned, some of these people die from COVID-19. It's a very unfair situation. But going back to your question, is the issue that many of these people, if the judge decides to send them to probation instead of to jail, the outcomes for the society, for the families, for the individual, have consistently shown to be more beneficial. So I think information for the community, for the people to understand that there may be somebody who, not, if it's my family, may take it more personal, and I think it's important. But there's so many pieces of evidence-based public decision making that are, not well known, and that by releasing, for example, if you're driving without a license and you go to jail, and you stay there for more than 5 days, it makes a very significant difference compared if you are sent home and then have a subsequent, being on probation, and then presenting later to your court appointment in terms of people being reincarcerated or not. The other thing that is interesting, like if you move to like the criminal or violent crimes section, and this is the part where I learned last week, is that most people that have, like if you divide crimes into like low level, middle level, high level, and there's different categories to do this, is that those at the highest level and the medium level tend to, even after a year of being in prison, the rate of recidivism is close to 0%.
Oh.
So, and then people who are on life sentences, this is what some of these NGOs do, is that life sentencing, those people are particularly, if you spend more than 10 years, nobody who's released before or is released, like not in life, but maybe released before then, have gone back to commit a crime. So there is something about this that we need to make sure that people understand that there is a risk, and that the majority of people that have been released so far during the COVID-19 pandemic have been people in jail that were waiting for sentencing, and that either they were drinking a beer on the street, or like, sadly, the parole system. So if you don't go to your parole office, or you don't complete a training program, that's enough self-fulfilling prophecy to take you back to jail again. And it becomes this revolving door for many people that ends up in really bad outcomes. And again, New Jersey and New York had these new laws that started actually in the Brooklyn, where they actually send people with minor offenses, that 90%, instead of going to jail, they send them to probation. And they have shown that since 2017, that not only crime has gone down, but public safety as measured in different ways have improved. And the money that was invested into that have gone into community-based projects with significant, community building projects. So it is just a matter of, as you mentioned, and thank you for giving me the opportunity to tell you this, is that there's a way ahead that shows that, instead of putting these people and the cruelty of doing this does not change anything in a good way for anyone. And there's ways that you could still make them responsible for their acts without overdoing it, and that may provide benefit for everyone. And, with the COVID-19 pandemic has shown us that basically, if you don't take care of these people in jail too, is that it comes back to the community. So no one is safe until everybody's safe. And that's one important thing, one message that is not about human rights, but it's also about public health.
Great, thank you very much. A question I think probably any of you could answer, but Dr. Dickinson, you mentioned it first, so I think, I'll just start with you if you don't mind. It's this idea, and I know you mentioned it specifically for Boulder, that they're trying to balance, who reaps the benefit of a policy and who bears the cost. How do we adjudicate that when it's often the same group? So the person who can go back to work is then at greater risk of contacting somebody with COVID, although they're earning a salary. How is Boulder or balancing that, and how are other groups balancing that?
Yeah, that's a good question. I think that's sort of the goal is that you have, it's that the groups that are benefiting are also, paying their fair share, I guess. I think what we've seen, obviously way too often, is that the, more well-off groups are more likely to benefit from a particular policy, and the costs are borne by others. Sidestepping your question a tiny bit, but not entirely. One interesting aspect of that conversation with the city of Boulder was thinking about, and I think this is a really interesting thing when it comes to, you know, cities, and, you know, is that we have, I think, thinking about who is and isn't included in our analysis and in our jurisdictional boundaries is also really important to this. And so one thing that they were talking about is that, you know, a place like Boulder is a you know, pretty affluent, fairly homogenous, you know, racially city. Not that there aren't, you know, communities of color in the city that have been overlooked, but that they tend to be smaller. And at the same time, there are a lot of people who commute into Boulder to work in the service industry there, for example, and things like that. And so one thing that they try to be very cognizant of is, you know, in what ways, you know, how can they, for a, you know, for this racial equity team they have that's, you know, sort of within the government, can they open that up to people who have a significant connection to Boulder, even if they don't live there? And so that was something that they brought up is trying to, so again, when thinking about those benefits and burdens, it may be great for residents of Boulder to do certain things. And I think there are a lot of examples of that. If you think about the way that, you know, Boulder in particular is, you know, city planning, green space, and you know, height restrictions, and all of these things that people in the city of Boulder, I'm actually from Boulder originally myself, like those were like these points of pride growing up, and they have created the conditions that often exclude you know, folks from being an accessible and inclusive community for people. So so I think part of the answer is making sure that when you're asking those questions, you are thinking about all affected parties and all stakeholders in a decision, and not just the folks who are at the table or the folks who have, you know, what structures have given folks a seat at the table.
Does anybody else want to add to that, or? All right. Well, I know we have just a couple minutes left, so maybe, and we had a little bit of a chance to talk in between grand rounds and now, so I know what I want to ask, but it's definitely a selfish question because I'm thinking about my residents who want to get engaged and they want to get involved and they want to do good in the world. How can people listening to this talk and this after talk get engaged in these practices and in shaping these policies? What should they actually go do tomorrow?
I love that question, Jeff. It's something I've been reflecting on a lot, because really it's the next generation that is going to change these crazy structures of inequity. And, you know, sort of reflecting on my own path, and I love what Carlos is doing with the medical students, because I think that exposing medical students and residents, you know, so sort of earlier on to these bigger issues. So, you know, they're not just focused on the patient in front of them, but the structures of inequity that impact their patient. And I've thought about, you know, how can we begin to engage them more in all of this work and train them so that they can work with media and engage health policy stakeholders and, you know, identify something that they're passionate about. And I think that's at the heart of it is once they identify something they're passionate about, how can they then take that passion and move forward? And it's you know, in my mind, I feel like there's a tool set for this, and perhaps a framework of how each person can sort of individually take that topic or passion of interest. And so I think for folks listening out there, I mentioned, you know, education as a possible topic, but really it's whatever, you know, I had a patient today, for example, with unstable housing. She needs to be on IV antibiotics. You know, there's the issue of discharge and all of that. And my one of my interns, his goal for the week is to focus on a patient in a more holistic way. And so we talked about housing, we talked about IV drug use and what support systems are out there. And we did a lit search and a computer search. And so, it's interesting sort of learning, as a resident, like what are the available resources for these patients? And then connecting with those nonprofit community groups to say, I'm seeing a lot of patients with IV drug use. Do you have peer support programs? How can I be involved? And so sort of, beginning to make those connections, gathering a coalition, and then learning what the policies and structures are behind that, and then, having a game plan. So.
If I may add to Lily, Jeff, I think the New England Journal of Medicine, you probably seen this, has a series of articles called Case Studies in Social Sciences.
Mm-hmm.
So maybe like referring to them initially and then trying to identify somebody who, like if you're interested in jails, or interested in, to approach one of us and maybe other people that, were not in the grand rounds today. But I think, I offer these because in the residency program for you, and I understand by working with the fellows, is that having somebody that you can go to and they can tell you either go to Shanta or go to Lily or go to Catherine or go to Madiha, Abdul, Madif, anyone that we know, and I don't know more, many more people as probably Shanta, of course, and Lily, but trying to connect to the right person, I think is crucial. And as you know, for like as mentors or finding projects. So I offer, to be a contact person for some of these, I would say, projects that we can find, I would not know, or maybe we can develop a list of some of these potential activities that we're doing in different ways. But I would encourage you to, send them over or send them to Shanta. And I'm not speaking on behalf of Shanta, but because I know she has enough. But we always, I think that's the key part too. I think it's crucial that we listen to them and we try to push them, because if they don't hear soon because they're busy, they tend to stop doing, or they stop not caring, not necessarily caring, but they lose that momentum on their interest. So once somebody comes, we usually try to, and I speak on behalf of everyone here involved, we push them as much as we can to find projects or whatever. So I'll be happy to do that if you wanted to.
I'm also humbled to be with this group, and also remember myself, not just as a resident, but as a fellow, and even sometimes now as an attending, feeling overwhelmed. And Dr. Dickinson mentioned it, and she put it in her last slide. And I would need something bite-sized to project. Like, I listened to Carlos talk, and I think I can't go to a jail and like test people and reach out to that community and save their lives and publish all of these papers. Or I think about Lily, I can't change legislation. Like, I'm trying to work 80 hours a week. Thank you, residents, for taking care of all the patients with COVID. And in your spare time, do this life-changing, earth-changing work. And so what I took away from this talk and getting to learn from these folks today was there are some little things, Jeff, that you mentioned that we could do right now. I'm going to go back to, Katie's slide, and I took a screenshot of it during your talk, Katie. You sent me the slides, and I still took a screenshot. I'm going to send an email. I'm going to look up the things that are happening, and I'm going to pick one. And I'm going to start with one, and I'm going to write a letter, or I'm going to tell my med students to do it with me, or I'm going to use the med students who are rounding with me, who are waiting for the COVID pandemic to come over, and tell them to do it. And that's going to be my little bite-sized contribution. I think it can be so overwhelming. We're in a service profession, and we provide service every day in the care of our patients. And when you go home, sometimes that extra activation energy to do something big just isn't there. But we're role models for communities, and they need for us to be willing to say, well, I wrote a letter, or I thought about the question, should I be eating meat right now because of the, things that are happening in the meatpacking industry. It doesn't mean you become vegan, but it means you think about these issues and you stay informed about whether or not that's happening. So some of the little things that are short of a research project or a policy change are things that I think that we should all do. I also wanted to say how much the medical students have inspired us to really be more detailed in the histories that we're taking and that we're documenting. A lot of times for the residents I was reading your HMPs and to pull out this information about the fact that the person worked at DIA, or that they were a landscaper who didn't get to stay home, or that 9 people lived in their families, or that they didn't get to control their diabetes because they didn't have access to insurance. So keep documenting that stuff. If you're on a busy rotation and can't find the space to be a life-changing advocate, think about the patients in front of you and do the things you can do right for them. It's everybody's responsibility, and I get inspired when I feel it happening kind of all around us. So maybe not as big as some of my co-panelists in changing the world, but just paying attention to the little things, I think will make us all make the change together.
I love that. Thank you. Dr. Dickinson, did you want to give you the last word?
Yeah, I mean, I think everybody said I think the 2 notes that I had resonate really well with what everybody else said. So first is know yourself. So figure out what, don't feel like you have to change and completely pivot overnight to being a completely different person in order to take these things on. Figure out what you do well and what motivates you. And then like others were saying, find the ways to do those, to make those small changes or to take those, small actions in groups with other people that will cascade and turn into bigger things. And then the other is to listen and learn. So I think as, over the past few years, I feel like that's one of the most important things that I've done is to expand the network of people that I follow on Twitter, to look for, to read books like this book. I'm gonna keep plugging this book. I have no mistake in it. But, just listening and learning. And I think it then, to feel like you can take that time to just sit back and let things percolate, because then you have moments where you're asked to give a talk and you get to, spout out some of these things that you've taken on and spread the word. So yeah, know yourself and listen and learn, and then find those opportunities to act where you can.
It's great. Well, I just want to say thank you to all for taking the time with us this afternoon. Also for the excellent grand rounds. I think this is really great. It's inspirational and it's actionable, which is probably one of the best things we can be as educators. So Dr. Cervantes, Dr. Zimmer, Dr. Dickinson, and Dr. Franco Paredes, thank you very much for joining us today, and to all of our audience. Thank you.
Thank you. Bye.